And welcome back to the morning show. It's time for morning rounds. Every March is Multiple Sclerosis Awareness Month.
And approximately 2.5 million people worldwide suffer from MS. Neurologist Dr. Habib with Christie Clinic joins us now with more details. Good morning, doctor. How you doing?
Good morning. Good. How are you?
Good, thanks. Thanks for joining us this morning. So first and foremost, can you tell us what MS is?
Yeah, so multiple sclerosis is a disease of the central nervous system, which means that it involves the brain, spinal cord, optic nerve. Body's own immune system attacks the brain. And what it does, the neurons, the nerve tissue, the covering of those neurons are attacked by our immune system and causes inflammation, which then leads to the scar tissue formation, and then it affects the communication between the central nervous system and the body.
And what causes MS?
So we don't know. I mean, there is no known cause for the MS, but basically, what we know is that it's an autoimmune disease, and but we still don't know why some people get it and the others don't.
And doctor, there are some risk factors that we should know about. What are those?
So yeah, there are some genetic risk factors, and then there are also some environmental risk factors. For example, the age, it's more common between 20 to 40 years of age, and then it's two to three-thirds more common in women than men. If someone has family history, they have more risk for getting the MS. There are certain infections that can also increase the risk for MS, like Epstein-Barr virus infection, infectious mononucleosis. The Caucasian race has high risk, and then people who live in temperate climate zone, countries like Canada, Northern USA, Southeast Australia, New Zealand, Europe, they have higher risk. Then vitamin D deficiency, lack of sun exposure increases your risk for MS. And then there are certain autoimmune diseases like thyroid disease, type 1 diabetes, pernicious anemia, inflammatory bowel disease. So these people have high risk for getting the MS, as well as patients who have a history of smoking. They also have high risk.
And to my understanding, there are several symptoms out there when it comes to MS. Can you explain to us what some of those might be?
Yes, the symptoms depend on the type of part of the nervous system involved. So they are different in different patients, but for example, they can develop weakness or paralysis of one side of the body, paresthesia, numbness of one side of the body, trunk. Then bending the neck can cause electric shock-like sensation in the whole body, tremors or incoordination of the arms and legs, difficulty walking, vision loss, which could be partial or complete, with painful eye movement, double vision, blurred vision, fatigue and tiredness, and then also difficulty controlling bladder or bowel, and sexual dysfunction.
And doctor, you mentioned this affects patients differently. Is there a cure for MS?
There is no cure for MS, but there are treatments now available. There are about 21, 22 medications that are out there, and these medications actually help slow down the disease process.
And how is this diagnosed?
So it's basically if you have any of these symptoms, so you go see your doctor, and he will do a take thorough history, physical examination, and based on those, he will order some blood tests, and then get an MRI of the brain and the spine, get a lumbar puncture. You may need a visual evoked potential, and based on all these tests, the diagnosis of MS is made.
Doctor, you mentioned that there are a number of medications that patients can be prescribed. So there is a little bit of hope if you get a diagnosis like this.
Oh, yes. I mean, again, there's a lot of research going on. I mean, every few months we have a new medication that comes out, and the newer medications are actually a lot more stronger than what we had before.
When it comes to some of those patients who haven't been diagnosed yet, what are some of those symptoms that they might have beforehand, before going to visit a doctor?
So again, the symptoms are like we talked about, weakness or paralysis, the vertigo, dizziness, vision loss, fatigue, tiredness, paresthesia. Any of those symptoms, should be concerned and see your provider.
Dr. Habib, thanks so much for your time this morning. We really appreciate it.
All right, thank you.
Thank you. Jack has your forecast next. We'll be right back.